Greetings all, this is Matthew Sobel and this is a video lecture on health promotion, especially in the U.S. healthcare system. So let's take a look at some definitions of health promotion. The World Health Organization defines it as the process of enabling people to increase control over and improve their health. So it goes beyond a focus on just the individual's behaviors towards a broader range of social and environmental interventions. The textbook defines health promotion as the combined educational, organizational, procedural, environmental, social, and financial supports that help individuals and groups reduce negative health behaviors. So, in the past, a lot of times when we have major health issues such as the obesity epidemic, a lot of times people will consider that to be a crisis on an individual level. And we need to realize that it goes beyond just an individual's behavior and belief system, that this is a cultural problem, and it's a problem that needs to be fixed from a cultural standpoint. So if you remember this social ecologic model, or the ecologic model, or the public health model, whichever term you prefer, we covered this in a previous lecture. It starts, with the individual, of course, their knowledge, their genetics, their attitudes, their education, their abilities, their skill sets. Of course, social networks are extremely important with health or disease states, not only with their social networks, but how they interact within organizations such as schools or the workplace, how the community could hopefully support health. And then public policies, of course, can influence an individual's health. Again, the determinants of health, we already looked at this as well. The individual's age, their genetics, their lifestyle behaviors, their lifestyle factors, smoking rates, their diet, things like that. And then again, of course, social and community networks. And then socioeconomic status, like things like housing and access to clean water and sanitation, healthy employment, and living and working conditions. So all these things are extremely important. So let's take a look at the health promotion model and consider it for the U.S. healthcare system. So currently, right now, probably the most important public health crisis that we're facing is poor diet, specifically low fruit and vegetable intake. The CDC considers low fruit and vegetable consumption to be a major public health crisis. Approximately 75% of the population is not meeting the 5-a-day recommendations. Less than 5% of the population meets the 8 to 13 servings a day that are recommended by other groups, including the Harvard School of Public Health and the American Cancer Society. So this low fruit and vegetable intake is a major contributor to illness and death in the United States. It affects people at all different socioeconomic levels, but especially people in low-income areas. We spend about $3 trillion a year on healthcare right now. About 75% of that is spent on preventable, non-communicable health conditions, cardiovascular disease, cancer, things like asthma, allergies, type 2 diabetes, obesity. So they keep saying over and over again, with regards to the healthcare crisis in general, that we need more doctors, we need more nurses, we need a stronger healthcare system. What we need is less sick people. And the way that we create less sick people is to promote wellness as much as possible. And this can be done. There are some very effective programs that have been put into place, evidence-based programs. So the Affordable Care Act, which was written at least in part by the public health community, has created a large number of public health initiatives that focus on health education and health promotion at both the community and individual levels. What's interesting is that the Affordable Care Act also mandates that all health insurers and providers offer lifestyle medicine as a complement or an alternative to conventional care for cardiovascular disease. So this means that if you are, unfortunately diagnosed with cardiovascular disease, according to the law right now, and it's something that will take time, but eventually will be rolled out, your doctor will have to offer you lifestyle medicine as an alternative to the traditional pharmacological and surgical interventions that are used. And lifestyle medicine is actually much more effective at both treating and reversing cardiovascular disease than the current pharmacological and surgical interventions. So the USDA is also jumping on board with the health promotion. They are creating programs to encourage consumption of locally grown produce. They've started a bunch of farm to school programs. Actually, they're not starting these programs. They are providing grants for these programs. So other people are actually starting the programs. They have small-scale sustainable agricultural programs, community garden centers for low-income areas, and there's a lot of money out there for health promotion right now, and it's kind of cool to see that people are taking advantage of this. The school lunch programs. Um, we've seen reform in this led by the First Lady. And what we've seen, I mean, these reforms only started a couple of years ago. Children actually have increased fruit consumption by one serving. Vegetable consumption has not gone up at all. Um, but that doesn't sound like much, but if half the US population increased their consumption of fruit by one serving, there would be 20,000 deaths from cardiovascular disease prevented every year. So even one serving of fruit and vegetable, one serving of fruit can have a significant impact. Another, I don't have it up here, but another estimate that I read was that an increase of 3 grams of fiber a day. So that's about an apple, a little bit less, not even a full apple. It would result in savings of $20 billion a year in just the treatment of constipation. Constipation is a chronic issue, and again, it's related to a low fiber intake. Fiber is found in fruits and vegetables. So these health promotion programs have significant potential to impact our overall healthcare spending. There are groups called food policy councils, and I'm not sure if Pennsylvania has one of these, but other states do, and Pennsylvania has similar programs. And these are citizens, government officials, scientists, educators. They get together and they in what they call a civic engagement to engage stakeholders to develop, appropriate food programs, health promotion programs. So they design urban planning, or excuse me, they get involved in urban planning. They establish community gardens, farm to school programs, farm to prison programs, um, supermarket and retail stores, retail stores, especially in low income areas. A lot of these are based off of a program called EPODE. I think that's pronounced correct. It's actually a French acronym. It's an acronym for a term in French. In French, it's "Together we can beat obesity." That's what it means. I don't speak French, but EPODE is the acronym for it. It's the world's largest obesity prevention program, and they use evidence-based methodology to prevent childhood obesity. And again, they get local stakeholders, they get local politicians, local educators, local physicians, local parents, and they get everybody together and they work together to help prevent obesity. They make sure that from a city planning perspective, there's enough places to exercise. They make sure that the schools actually have healthy foods instead of junk food. They make sure that they probably restrict advertising of junk food, at least in the local neighborhoods. They make sure that the retail stores all have access to or provide access to healthy foods. And these programs work. They have about half the obesity rates of the neighboring towns that do not have the EPODE programs. As far as Pennsylvania, and again, I'm closer to the Philadelphia area, so I'm not 100% about Harrisburg, but there is a group called the Reinvestment Fund, and they fund the group. It's called Philabundance. It's a big anti-hunger program in Philadelphia, and they just invest a lot of money back into low-income areas. And you may have heard the term food desert. So the USDA has certain low-income areas that are designated as food deserts. And the TRF has been doing a lot of work to increase access to food in those areas. And they actually reported a significant decrease in people nationwide with limited access to healthy food in just the past decade. That picture there is a picture there's a small city just south of Philadelphia. It's called Chester. And it's a low-income area. It's designated as a food desert by the USDA. Fair and Square is the nation's first nonprofit supermarket, and it's right in the middle of Chester. It just opened within the past few months. So it's kind of cool programs that are being out there, that are being put out there. Primarily, it's a combination of the Affordable Care Act. The Affordable Care Act certainly created a lot of health promotion grant money, but the Reinvestment Fund has been around for quite a while. And this is the program that I'm involved with. This is health promotion that I do more in my local area. It's called Greener Partners, nonprofit group, and the mission is to increase and strengthen public access to seasonal local food and educate people of all ages about where food comes from and help them make healthier healthier communities and smarter choices. So these are some of the results of health promotion. Some of the programs that are going on. Health promotion is based in education, and everything about preventative medicine is about educating people so that they can make smarter choices, and then giving them the proper support system to actually follow up with those healthier decisions. So it's not just about giving people education, but also giving them the opportunity to actually eat healthy food, because it's not enough just to tell people to eat healthy. You actually have to take the extra step and ensure that they have access to that food and the knowledge how to use that food as well. And that is all part of health promotion. Okay, I hope this was helpful. Take care.